Introducing the new upgraded MagnoSeek M19 AI cellular scanning device that Price International United States is releasing into the shores of the United States this coming January 2026. I will be showing you a sample scanning procedure of a typical patient. As MagnoSeek scans your entire body, it returns a report indicated by symbols of numbers from 1 through 6. Number 1 to 3 indicates normal patterns, number 1 being a dormant cell, and number 2 indicates a healthy cell, with 3 being a condition that is normal for the age of the person. Then the abnormalities begin starting with number 4, which indicates a cell that's beginning to exhibit imbalance, and number 5, which indicates a cell that is in dysregulation, and number 6 indicates a cell in serious disruption. Now let me start showing you some of these scanning on this particular person. Now what you see now is a typical vertebra being scanned, and you might see some of the symbols indicated by the numbers 1 through 6. Most likely the ones you see are the ones that are in yellow, which means that that particular part of the body is in good condition. Now you might find the numbers 3, which is an upright triangle, which indicates a condition that is typical for the person. And number 4, we're going to start seeing those in a little while. Remember, 4 is a inverted triangle, and number 5 is a diagonal square, and number 6 is a regular square. Now we're going to see that. Okay, now there you saw just one 4 there in that particular part of the vertebra. Now that's a good one. That's a good one. Now there's some imbalance in that particular joint there. Oh, there's another one. Okay, we're going to go through some of these different conditions. Now, as you're scanning this and the patient is watching, your patient might agree with you. Oh yeah, there's a shoulder right there, and say, oh yes, I'm starting to have some pains there, and it kind of verifies some of the conditions that the actual patient. Here's another one, that right shoulder, and actually would verify the condition that the patient is actually experiencing. Now that's a okay. Now that's an elbow that's starting to get some imbalance. Oh, that's a typical one. That's a little heavily impacted, and you will see some different parts of the body that indicates dysregulation. Now, it's amazing how this device actually reveals all the different things in the body with an accuracy of between 95 to 97%. Now that's a knee joint, and you can see that's very heavily, very evident that this particular patient is experiencing some pains in the knee already. And here's another one. You'll see that. Wow, it's unbelievable. That's heavily impacted. Some that may indicate, some of the cartilage is probably gone. Now, on this particular patient, the patient is actually complaining of neuropathy. So if we can go back into that a little bit later, but that you can see some 4s and 5s in the foot area. It's amazing how it reveals all the different parts of the body from head to toe, and gives a report of over 12,000 points in the body, down to the DNA level. So there's no skipping. The good thing about it is the doctor would have a much more intelligent and accurate assessment of the patient, and with the patient actually looking at how the body is experiencing these different dysregulation, cellular dysregulation, and so it creates a beautiful symbiotic relationship between the patient and the doctor, where the patient actually understands what's happening, you know, to the body. Now, in this particular part of the hip joint, you'd see, some um, red triangles in there, which indicates a number 4 condition uh, in that particular joint. Now, the patient would most likely already tell you that, yes, I am experiencing some pain in there. And sometimes it might even indicate a possible existing condition that even the patient does not even experience any symptoms yet. And that is the beautiful part of it. Now, let us get into the cell restoration cycle. Now, this part shows a heart that is undergoing some cell restoration. As you see, there are there's lots of uh, number 4s in this heart that indicates some of the arteries and vessels in the heart are actually impacted somehow, one way or the other, maybe causing some reduced circulation and pumping ability in the heart. And now look at what happened after this. The cells of the arteries have been restored. It is now yellow. Now let's go now into this patient's brain. As you see, there are some number 5s. That's the diagonal squares, number 5s in the different parts of the brain. Now, MagnoSeek is now doing a cell restoration in that part of the brain, and it's hitting some of those. Um, there you go, the number 5 there. Those cells in dysregulation, and look at now. And after it's done, you'll find out. See, there's most of it is already done except for one, and we will have to do that again on this particular patient. But that is beautiful.